Members of the U.S. intelligence community remain divided over the origins of COVID-19. The Office of the Director of National Intelligence released a report on the virus Friday, 3 months after President Biden ordered a review into where it came from. According to the DNI, there are two likely sources. In simple terms, it either came from an infected animal or a lab. The report did not draw a definitive conclusion, and the authors said they're not even very confident about their key findings. Dr. Stanley Perlman is a professor of microbiology and immunology at the University of Iowa, go Hawks, and a pediatric infectious disease physician. He joins me now for more. Dr. Perlman, we've been talking for a while about the possible origins. Now that this report has been released by the DNI, what's your initial response?
I think the report says basically what I think we thought it was going to say, that it's very hard at this point to really pin down, not quite the origin, because I think it's considered to be a bat virus in its origin, but rather how did it enter human populations. So the report really discussed two possibilities. One of them is that it came from a lab accident. The second one is that it came from the Wuhan market or some other place where it was released either from an infected human who had been in contact with animals that were infected from a bat, or with one of those animals, or with a bat. So those are the basic scenarios. In all cases, though, it started as a bat virus, and then how did it get into human populations?
Well, you know, there's been a lot of conspiracy theories and questions about the origins of the coronavirus. Was this report able to rule any of those out?
Well, the report ruled out that this was known to Chinese officials before it was actually present in human populations, and it said it was unlikely that it was bioengineered. I think it's very hard to engineer a virus like this, so I put that as very, very unlikely. And so it came down to really basically whether it just came from a human or an animal that was naturally infected, or from being manipulated, maybe manipulated in the lab, but more importantly, being present in the laboratory. And that's the two basic scenarios. I think people who think about this consider those scenarios possible and put different weights on the likelihood of one or the other. And that's really, to my mind, where the discussion is.
Well, officials say that China's refusal to share information is making it difficult to come to a definitive conclusion. Will it ever be possible without China's cooperation to say for sure how this virus emerged? And why aren't Chinese authorities fully cooperating?
Yeah, so I don't know the answer to that second question, but I think we need Chinese cooperation to figure this out, because this is certainly a virus that began, to my mind anyway, certainly began in China or in Southeast Asia. So we need to know more, as much as we can, about possible animals that were infected with the virus, about possible bat viruses, and those are being studied and the information is being released. We need to know more about what happened in that Wuhan market, but we probably can't, because the animals that were there were destroyed. We need to know more about farmed animals, which is hard because time is passing and many of them were destroyed. And also this virus spreads back to animals. So let's say this started from an animal like a mink, which of course is not likely or not shown. But we now infect minks. So if we found an infected mink in the wild, we wouldn't know if it was an originally infected mink or a human infected that mink. So it's become more and more difficult as time goes on. But I think we still need to figure out where it came from, because we obviously want to prevent a future pandemic. We don't want to go through this again.
Well, COVID cases and hospitalizations are still surging around the U.S. So let's move away perhaps from the origins of it to talking about the practicality of it. What more needs to be done, and how are you seeing the pandemic's arc playing out right now?
Yeah, so I think it's pretty hard to predict. In other countries, the Delta variant, which is the one that's sweeping across the U.S., actually stopped spreading after a period of time for reasons that we don't understand in other countries such as India. So we don't really understand all the dynamics of the virus. But what we do know is that this one is more contagious. And because of that, people have to be just more careful, doing all the things that will prevent their getting sick. So people who are vaccinated have a much lower risk of being infected, even of getting severe disease, even if they're infected. They have probably a less chance of transmitting the virus to others. That's a little less certain at this point. Getting vaccinated is a part of that. And then doing things like wearing masks and social distancing. People hate doing it, but that's really the way. Once you have a virus that's very contagious, that's what one has to do to prevent the infection. So it's the same things. And there's some evidence that this virus may cause more severe disease. I think that's a little less certain. So it's not, we're not at the beginning anymore. We have lots of people who are mostly protected, and vaccination really does a great job protecting against the severe consequences. That has to be emphasized. Even with people who are vaccinated getting infected, they are much, much, much lower risk of being hospitalized, of being in an ICU or dying. So that's all the more reason that vaccination is really a key part of our fight against the virus.
Well, Dr. Perlman, as you say, we're no longer at the beginning. In fact, it feels like we have been fighting this pandemic forever, just in terms of how it weighs on us. But it's not clear yet that we're at the end. Are you concerned, given how bad the Delta variant is, about other variants as the virus continues to spread throughout the U.S. population and throughout the world?
Yeah, that's a really good question, because the way this virus works, I don't think it has an infinite number of ways to change. For example, like influenza seems to be able to change quite a bit and still be very effective as a virus. I don't think this virus can do that. But this virus is still coming up with ways to transmit better from person to person, and then possibly also to evade some of the immune responses, either from prior infection or from vaccination. So it's really, we just have to keep paying attention, getting as many virus samples as we can, and determining as much as we can about where the virus is and what the sequences are, and will in fact evade the vaccine-induced responses. As I said before, luckily we're not at that point at all yet.
All right. Dr. Stanley Perlman, thank you for joining me, and thank you for all that you do.
Thank you.